That is right. All right. Let's get started. Welcome, welcome, welcome to our final empowerment week of the year. Can you guys believe this is our fourth empowerment of 2021? Can you believe that we're almost to the end of 2021? I definitely can't. I feel like this year has just flown by. And you guys that have been here before, you know the deal. We always have such an incredible presenter, and today is no different. Today we have Brittney. She is a certified health and wellness coach, YouTuber, and disability advocate that helps people with disabilities live a happy, healthy, awesome life through her brand, Empowered Para. She was paralyzed at the age of 13 and is a T6 paraplegic. She has a husband and 2 kids living in Central Alberta, Canada. So winter is about to strike for sure. If you guys don't know, Kenda Tires gives away a set of manual wheelchair tires to anyone that uses a manual chair. Please drop your name into the chat. We'll have a drawing, and at the end, the name will be drawn. So you have to stay all the way through the end of the course to be eligible for that. And then, yeah. So without further ado, we are going to let Brittney take over. And thank you so much for, volunteering your time and for joining us for this week.
Awesome. Thanks for having me. Happy to be here. And I'm going to apologize in advance if my children come through that door, because no matter how many times I tell them to not bug me when I'm doing something, my daughter always comes in and like peeks her head in, and it's like, oh. So I'm just apologizing in advance for that possibly happening. Okay, so today I'm going to talk about all things bowel and bladder, basically about my experience with bowel and bladder, how it controlled my life, how I changed that, and how you guys can too. And yeah, I'm going to share some stories first, and then we'll jump into exactly what I did over the years, and then you guys can ask me some questions. So here we go. It's January 2000, the infamous Y2K, and I'm 14. And while my friends are all celebrating the new year and the fact that the computers didn't crash and the world is still turning, I'm laying in a hospital bed in rehab.
Michigan auto insurance companies.
All right, can I?
Drivers by billions, pointing to huge surpluses as evidence that drivers are owed.
I can't mute her. Kathy, can you mute yourself, please?
There, awesome. All right, okay, so it's been almost 4 years since I was paralyzed in a snowmobile accident. And I am throwing up after taking more laxatives than my body can handle. The nurses come in frequently to check if I've had any sign of a bowel movement. And as I tune out what the nurses are doing to the bottom half of my body, I think about what my friends would do if they knew I was wearing a diaper and having nurses wipe my butt like a baby. I cry myself to sleep knowing that when I wake up, I will be bombarded again with my bowel and bladder, the only thing that seems to matter now. It's March of 2000, and I'm finally back home after 3 months in the hospital. It's time to go back to school, and I'm busy counting how many hours I will be away from my mom. I have given up on cathing on my own or doing my own bowel routine, and my mom is now my caregiver. I'm a slave to the 4-hour time window that tells me how long I can be without her. While my friends are all eating lunch and laughing at school, I wait for my mom to pick me up from school to take me home where she can help me cath. My bladder controls my life. I'm 15 and in grade 9. It's been 1 year since I was paralyzed, and I'm sitting in social studies class after lunch. I decide to stay at school for lunch today so I can be with my friends, finally, instead of going home at lunch with my mom to help me cath. I had discovered that if I was careful, I could go 12 hours without cathing. Don't recommend that, as long as I didn't drink anything. I thought that would be okay when I was 14. I discovered that I was, sorry, I missed where I was. That wasn't going to be the plan on this day, though. As I'm sitting taking notes, my friend looks at me and says, "Why is your chair leaking?" I immediately know that I'm peeing my pants in the middle of class, and I am just dying. I don't say anything. It's like, it felt like hours. It was like seconds until my teacher says, "It's just snow melting off of her tires." It was wintertime, thankfully, so that made sense. That seemed to satisfy their curiosity, and they all went back to doing what they were doing, except me, because I spent the next hour thinking of a logical excuse as to why I would have to go home so that I could cath and change out of my wet pants. My bladder controlled my life. Sorry, my screen's just being weird. I'm 16 and my boyfriend invites me to go to Grand Prairie for the day with his family. Grand Prairie is 2 hours away from where I live, 2 hours each way. That's 4 hours. I do the math and hope that if we only spend 2 hours there, I can make it home in time to cath at the 6-hour mark. I still can't cath on my own, so I need to get home to where my mom is so that she can help me. I take a chance and decide to go, hoping that for once I can just be a teenager and have fun with my boyfriend. The minute my boyfriend lifts me in the car, I remember all the things that can go wrong. What if I pee on his mom's seat? What if I poop my pants while we're there? Who's going to help me get cleaned up? I'm too afraid to admit that I don't want to go, and also terrified about the trip ahead. I don't remember where we went or what we did that day because all I could think of was my bowel and bladder. Is that gas bubble a sign that I have to poop? Are my pants wet? Did I pee? I think I'm getting autonomic dysreflexia. My bowel and bladder control my life. It's 2005 and I'm getting ready to move out of the house. I'm at my doctor getting prescriptions for antibiotics because I'm terrified that when I move to the city, I won't be able to find a doctor to manage my UTIs. My doctor is telling me all the things I need to know when I find a new doctor, that I need a standing order at a lab in order to take urine samples, that I'm not supposed to take antibiotics until the results of the culture say that the bacteria count is 10 to the 8th bacteria forming cultures. I still remember all of this stuff. And that if I ever have a UTI that makes me super sick, I need to go to the hospital. I write everything down and leave feeling just as scared as when I arrived. Will I ever be able to find a doctor in this new city that understands that my bowel and bladder control my life? I'm 19 and I'm in my first year of university. I've finally become independent with my personal care, yay me. And I'm excited that I'm now in control of my bowel and bladder. That is until I start getting diarrhea for some reason that I can't seem to figure out. I'm now living with my boyfriend, yay, who doesn't know anything about my bowel and bladder issues. And I'm terrified that I'm going to have an accident around him, which is like terrifying if you live with somebody 24/7. My sister lives close by so that if I do have an accident, she can come and help me. And I'm terrified every single time she leaves for anything. Like if she goes away with her friends for the weekend, I'm just like, oh my God, what if I have an accident and she's not there? Because I have a hard time pulling up my pants, doing anything by myself still. And every stink is a trigger for me. So it doesn't matter whether it's my stink. I think it's my stink and it's a trigger for me. I rush home. If there's like any bad smell in the grocery store, if I'm sitting on the couch and my cat farted, I think it's me. So I go to the toilet every single time just in case, because I'm really scared that I'm going to have diarrhea. So I spend more than 6 months trying to figure out the case of the diarrhea, which I never really did. And again, my bowel controlled my life. It's now 2011 and I'm in Mexico. I'm in my hotel room with my wedding dress on and I'm popping Imodium. If anybody doesn't know what Imodium is, it's like anti-diarrhea medication. My stomach is full of butterflies, is gurgling, and all I can think is, please don't happen now. Please just let me get through my wedding without any bowel issues. I'm looking over my vows, but I'm not really seeing them because my bowel is all I can think of. Even on my wedding day, my bowel controlled my life. It's 2012 and I'm 8 months pregnant. I've had my 6th urinary tract infection of my pregnancy and I make an emergency appointment with my obstetrician. My normal obstetrician is away, so I see the doctor filling in for her. She asks the reason for my visit and I tell her that I have a UTI again. She immediately asks me, how many UTIs have you had during your pregnancy? And when she hears the answer, she prescribes me prophylactic antibiotics, a thing she says that should have been done from the beginning of my pregnancy, since chronic UTIs can cause preterm labor. Yay. I leave the office feeling exhausted, and 2 weeks later, I go into labor with my daughter 5 weeks early. my bladder controls my life. And now it controls my daughter's too. Changed her birth date because I had a UTI. So if you haven't gotten the gist by now, my screen is being weird. My bladder controls my life. And I'm betting that it controls some of your guys' life too. Show of hands, for anybody's brave enough to take themselves off mute. Can they relate? Can you guys relate to any of these stories? Yeah, a lot, right? And this is kind of the norm for people with spinal cord injuries. And it sucks. So while this presentation is going to be about bowel and bladder for the rest of it, I'm hoping that it's actually about getting control of your bowel and bladder so that it doesn't control your life anymore. And my bowel and bladder doesn't control my life anymore because I took control of my bowel and bladder. And while it does take a lot of my focus still, and it does take a lot of my effort, I'm in the driver's seat. My bowel and bladder are no longer in the driver's seat. And so I'm hoping that what I share with you guys will allow you guys to be in the driver's seat with your bowel and bladder too. And even though it might be your focus, like take a lot of your focus, I'm hoping that it's not going to be like mine was, in total control all the time. So I'm just going to go through exactly what I did first off, take control of my bladder and then my bowel. So I kind of did them like at the same time, but I'm going to do one after the other just because it makes more sense logically. So number one for how I took control of my bladder was I stopped taking antibiotics. And this sounds really, I guess, not possible, because most of the doctors that you talk to will tell you that antibiotics are going to be part of your life forever with a spinal cord injury. That's what mine told me. And that's what I believed. I didn't believe any different because I thought the doctors knew better than me. And so I just kept taking them. And I got allergic to some of them and resistant to other ones. So I was paralyzed when I was 13. So when I started really wanting to take control of my bowel and bladder was after my daughter was born premature. And I was like, this is enough. And so I had been on antibiotics for years and I was getting 12 bladder infections a year. So you can imagine how many times I was on antibiotics. And it's not good for you to be on antibiotics all that time. And so I was, like I said, getting resistant to some and allergic to others. So I really wanted to change, but I didn't think I could. And luckily I had one doctor that did say, you know, if you want to go off antibiotics, you probably can. Like, it's probably more dangerous to be on them as many times as you are than it is to just have the infection. And I was like, what? Because a lot of my doctors before that had told me that it was really dangerous to have a UTI and not take antibiotics, that you could get septic and all these other things. And then I started doing research, and antibiotics really only came into existence in the 1900s. Some of them, most of them actually, not even until like 1920, 1940, 1950. So I'm like, if bladder infections were this deadly, absolutely deadly thing, I'm pretty sure all the women would have dropped dead off the face of the earth, you know, before they were 50, because women get UTIs. And so I started sort of challenging those beliefs. And now I'm not telling anybody on this call, if you feel sick or have a fever, to not take antibiotics. Definitely see your doctor and take antibiotics. But I am telling you that if you have a bladder infection that's causing incontinence, but no fever and no other symptoms, that you can probably cure it by drinking a lot of water and doing all the other things that I'm going to talk about. So I just wanted to like kind of bring up some of the things that made me really scared when I first thought about stopping antibiotics, because I didn't think I could. So is it dangerous to stop taking antibiotics? Most of the time, no. And in fact, there's studies on UTIs, and if they left the UTI for 7 days, and the women in the group that they were testing, if they agreed to not take antibiotics for 7 days, most of them didn't come back, and most of them tested, their urine was clear. So if it's just a routine, uncomplicated infection, then it's not unsafe or dangerous to not take antibiotics. And antibiotics actually ruin a lot of your healthy gut flora and natural vaginal flora that stop the bad bacteria from making it into your urethra in the first place. So as long as you can stay off of them long enough for that to build back up, then it's really beneficial. So the goal here for your bladder is to colonize it. When you keep taking antibiotics, you are wiping out all of the good and bad bacteria, and you're making your bladder sterile again. And what you want to do is have your bladder tissue become so robust and healthy that it doesn't get infected by the bacteria. The bacteria that come in and out on the catheter kind of just hang out in your bladder for a while, but they don't infect your tissue. So that's the goal after you have a spinal cord injury. And that's where I got to. I got to the point where the bacteria live in there fine, they multiply, but my bladder is healthy enough that it repels the bacteria. And I'll give you some strategies on how you can do that, as well as how you can help your body. But that's the goal. So that's what we're trying to get to. And the more we take antibiotics, the harder it is to colonize, because we just keep wiping out good and bad bacteria and sterilizing our bladder and not letting it get used to the bacteria that's in there, and not giving our urinary tract tissue a chance to kind of build up its own defenses against the bacteria. Okay, so that's the goal. And like I said before, the good vaginal microbiome, this is for women. Men have a microbiome in the same area that prevents the bacteria from our anus going up to our urethra. So as long as we don't take antibiotics and we keep that the microbiome in our groin area really robust, then it's going to help us prevent those infections just on its own. Okay, so that was basically the first thing I did, is stop taking antibiotics. Then I started drinking a lot of water. And the first thing people always tell me is I can't drink a lot of water. I don't have that many catheters. So I just want to say, while I'm on this topic, that I had to wash my catheters when I was doing this process. I don't wash them anymore because my husband has since gotten insurance at the job he has. So I get catheters paid for from that. So I don't reuse catheters anymore. But when I was going through this process initially, I had to wash catheters, and I washed them with a 10-day rotation and 10-day drying time. So if anybody has that as an excuse that they don't have enough catheters, you can buy 2 boxes of catheters. And I'm not advocating to wash catheters, because I really hope nobody has to. But if that is a choice you have to make, then it's possible to cure your UTIs or to help improve your bladder health, even if you have to wash your catheters. You just have to make sure that they are completely dry before you use them again. And they're in a spot, that a cat or a dog or something like that can't get at, where they're going to get bacteria on them again. I always kept them in a drawer, in a big dresser drawer, and had paper towels showing what day it was that I had them, that they were wet on, that I washed them on. And then I moved them until I had 10 little bundles. And then I used the dry ones. So drinking lots of water is possible, whether you have to wash catheters or not. And I still drink lots of water. So I always have, this is like a 2-cup teacup, and I always have just water or tea in there. And I drink it at least 500 milliliters, which is 16 ounces for Americans that don't use the metric system, in between every meal. And sometimes even more. So sometimes I drink 2 of these in between every meal. And I cath probably every 3 hours at minimum, and 4 hours at the absolute most. That fits my lifestyle. I'm not saying that you have to cath more than that if you absolutely can't, but the 6-hour window that doctors tell you about is, I think, too long. And the urologists that I've talked to, especially some of the ones that are really keen on drinking a lot of water, they've told me that bacteria multiply every 2 hours. So if you can keep your drinking and cathing so that you're cathing within the 2 to 3 hour mark, it's actually more beneficial, because then the bacteria aren't able to multiply. If you leave it at 6 hours, then you're fighting the bacteria amount. You're just fighting how many bacteria are in your bladder. So that's the second thing that I did. And it's non-negotiable for me now if I don't drink water. And sometimes I'll have a day where I get really dehydrated and it's before bed. I drink almost a liter of water before I go to bed. And I just know that I'm going to have to pee at midnight, in the middle of the night, because I don't want my bladder to get an infection the next day. I'd rather lose one night of a good sleep and, you know, flush my bladder. So that's always something that's always important to me. And that takes up a lot of my focus, but I get to decide when I drink and when I pee, and I'm not incontinent because I don't have a bladder infection. Because if I get a bladder infection, I'm incontinent every 5 minutes, and I'd rather pee every 2 hours than pee my pants every 5 minutes. So that's the second thing that I did. The third thing that I did is I ate garlic every single day. And so this garlic has a lot of studies on it that say it is antibacterial. There are not a lot of studies on it that say it's specifically used for bladder infections, but there is enough anecdotal evidence out there that says that it works for bladder infections. And I found this anecdotal evidence just on an obscure forum that I was on from an actual doctor. It was like a doctor's forum. And one of the doctors was saying that there was a patient he had that had a severe bladder infection when she was pregnant. And he told her, you don't have a choice. You have to go on antibiotics because this can cause preterm labor. And she said, please give me 2 days. I don't want to take antibiotics with the baby in my belly. And he gave her 2 days and said, if you can't clear up your bladder infection with whatever you're trying, you have to take antibiotics. So she went home, she ate a crap ton of garlic, and then she came back to his office and he tested her urine and it was all clear. So that's the forum that I read that kind of got me onto garlic. And so I started eating it a lot. So I'm going to share with you guys the exact dosages that I use, that if you want to try. It seems really disgusting, but in my experience and in many of my friends' experiences, it works. So if you want to prevent a bladder infection, what I did is I ate 2 cloves of garlic every morning and every night. In the morning, when I woke up for breakfast, sometimes I would put it in my smoothie. Couldn't really taste it that much in the smoothie. Sometimes you could a little bit. And at night I would eat the same 2 garlics, or the same 2 cloves, not the same ones, different ones. You can't eat the same thing twice. I would eat same dosage of garlic for prevention. If I get a bladder infection, I still do this to this day. I eat 3 cloves of garlic 3 times a day, and sometimes 4 times a day on the first day or 2. So that's a lot of garlic. And in order for it to work as an antibiotic, you have to let the allicin develop in it, which is the antibiotic component. So that happens when air touches the garlic. So if you have to cut it up so that the air and the oxygen can get to it to activate an enzyme that creates the allicin, which is the antibiotic component in garlic. So you can't just get the garlic in the grocery store that's like in the water or whatever. It has to be fresh garlic and you have to cut it up yourself. So I used to try and like chew it. Don't do that. Don't chew it. You'll throw up probably and you won't get it down because it's so spicy. So I cut it up into little tiny pieces that just are like little tiny chunks. And then I take like a little handful of little tiny chunks. Some of my friends put all the chunks in a little spoon and then just put it in your mouth, take a swig of water and swallow all the chunks at one time. Or I do it in a couple different rounds. So I do three little handfuls of like chunks of garlic and then 3 gulpfuls of water. So however you want to do it, just don't chew it because you'll probably, like I said, you'll probably puke. But so that's really all I did. Those 3 things are what I did. Since then, I've learned a lot more natural treatments for bladder infections. I have a natural bladder care guide for you guys that I'll throw in the chat that has way more information than we'll be able to talk about in this presentation. Yeah, but I'll give you a few more things right now that work really well. So I didn't use D-mannose at first when I cured my bladder infections. I just used garlic, but D-mannose I use now all the time. You can't cook the garlic. So somebody just asked, can you put it in an omelet or a breakfast or something like that? If you put it in raw, so if you wait till the omelet's done and just sprinkle it on, yep, good to go. As long as I forgot to say this, you have to cut it up and you have to let it sit 10 minutes. So just the enzyme can help develop that allicin. I forgot to say that, sorry. So you have to let it sit 10 minutes. So if you cut it up in little pieces or you can grate it or crush it or whatever, as long as the air gets to it, if you sprinkle that on an omelet and you like the taste of whole garlic like that, you can do it that way. I used to put it on toast sometimes and I didn't mind it like that when I was chewing it, but you can't cook it because that just takes away the end. It breaks down the enzyme essentially and the component that you're supposed to be activating. So you can't cook it, which kind of stinks. It has to be fresh. And there's been lots of studies on whether you can use like supplements and things like that, and if it's still the same, and every time it comes back that fresh garlic is better. So just fresh garlic, but you can put it in guacamole or something. Like I used to do that a lot, put it in guacamole and eat it for my lunchtime or my snack or whatever. It's a really garlicky guacamole, but you can find creative ways to kind of make it palatable if that's what you want to do, but can't cook it. So yeah, back to D-mannose. So D-mannose is it's a natural sugar molecule. It actually just mimics the same sugars that you have on the tissues, like the cell membranes of your urinary tract. And our body has a left hand, and our chemicals, molecules have a left hand and a right hand, kind of like our hands. But inside of our body, we have like a right-handed chemical or molecule on our tissue, and D-mannose is like the left-handed version of the sugar molecule that's on our tissue in our urinary tract. But so our body only recognizes one sugar, but the bacteria in our bladder, only E. coli. So if E. coli gets into our bladder, it recognizes both the sugar on our urinary tract tissue and D-mannose, which is the left-hand version of the sugar that we can take in pill form. And because our body doesn't recognize it, it doesn't absorb it like it would glucose or something like that. It goes straight through our pee. And once it's in our pee, E. coli recognize both types of sugar. So instead of attaching to our tissue in our urinary tract, it attaches to this D-mannose sugar that it thinks is our sugar on our urinary tract. So it thinks it's infecting the human tissue, but it's not. And so once it's attached, it can't unattach, and then it gets flushed out. So D-mannose is a really good thing for prevention because all you're doing is you're limiting the amount of bacteria that have a chance to attach to your the sugars in the tissues of your urinary tract. So I take it every day. And if you get a urinary tract infection, you can take it like 4 or 5 times a day, and it will help clear up the infection just because it's reducing the amount of bacteria that your body actually has to fight. So I think that's a really good one to take. And then cranberry, you can often find it in combination with the D-mannose. How is D-mannose spelled? It's D-MANNOSE, I think, D-mannose. I have to like look. Anybody else like me that can't spell unless you see it? I can't spell unless I see it. I don't even have a pen. I think I'll try and like throw it in the chat here. D-mannose. Yes, I was right. So that's what it is. Okay, so those are the, and cranberry, sorry, back to cranberry. What cranberry does is it makes your bladder wall slippery. So it basically makes the sugars in your urinary tract harder for the bacteria to attach to. They're less sticky and they're more slippery essentially. So the bacteria just can't attach as well. So those are two of the things. I have a supplement that's D-mannose and cranberry together, and I just take that every day, non-negotiable. Not that I didn't take it for years. So I cured my bladder infections and didn't take D-mannose for years, but it just makes it easier to prevent infections. So I just do it so that I don't have to think about it as much. It's just an easy way for my body to help repel the bacteria, so I don't have to constantly fight them off. And then one of my favorite antibiotics for other than garlic, so I always almost exclusively use garlic, but if I'm traveling or something and I need a natural antibiotic, I use uva ursi or golden seal, and that there's more information on those in that bladder guide that I'll throw in the chat. But those are probably the two most well known, and I'll write those in the chat. Uva ursi, and then golden seal, and you can get those at health food stores. Almost every naturopath, those will be like their go-to natural antibiotics, and they're just really effective. I've used them on their own and they've cured my bladder infections, and you can find a lot of tinctures, which are just basically like a medicine dissolved in alcohol. And you can get those at like natural health food stores and anywhere that you would get natural medicine. And you can get ones that have golden seal, uva ursi, different combinations of herbs that are beneficial for your bladder. So, but those are the things that I would look for. Like I said, we don't have time to talk about all of the things. So if you want, you can get that bladder guide, and I'll actually just drop it in the chat right now so that I don't forget. And then you guys can go there after.
If you also send that to us, Brittney, we can send it in the email with the recording.
Okay. Okay, awesome. I don't know. Normally that's not the link, but it is the link. It'll work too. But normally the link is my website /bladder guide, but that one will work too. It's just my email software. Okay. So those were the things that I did to take control of my bladder. Now we'll talk about my bowel. Just gonna grab my notes there. Okay, so the first thing that I did was I learned about my body. So I'm just gonna give you guys a little bit of a rundown of the things that really helped me understand what happens to your bowel when you're paralyzed, so that you understand what you have control over and what you don't have control over. Because I didn't really know what happens to your bowel when you're paralyzed. And even though I knew, neurogenic bowel, I didn't really understand what that meant, probably because I was 13 and didn't give a crap. And as an adult, I care more and I love science. So biology is kind of my thing. And so when I went back and learned about it, then it really helped. So your autonomic nervous system actually is responsible for most of the digestive tract, which is amazing news, because there isn't a whole lot actually affected bowel-wise when you're paralyzed to your bowel. There's a whole bunch of things that kind of collect together to make your bowels worse, but your bowel, how it actually functions when you eat and the peristalsis and stuff, most of that isn't affected at all. So the vagus nerve is a nerve that bypasses your spinal cord altogether, and it goes from your brain to lots of different things in your body, but it innervates from the esophagus, so like where we swallow, down to the mid-transverse colon. So if you're not familiar with your colon, it's your large intestine. It goes up, like if you were to touch your right hip bone, it goes up to your ribs, and then it goes across your body under your stomach, and then it turns downward at your rib cage on your left side, and then goes down on the, like towards your hip on the left side, and then goes out to your rectum, and then your anus, where you have a bowel movement. So that's your colon. And the only part that's affected after you're paralyzed is your mid-transverse colon. So in the middle of your stomach, so that part that's going across your stomach from this rib cage to this rib cage, in the middle, kind of just above your belly button, that's where it stops being innervated by the vagus nerve, and it starts being innervated by something else called the pelvic nerve. And that is paralyzed when you have a spinal cord injury for most people. So that's affected. And when we use things like suppositories, what we're doing is we are activating the reflex that's paralyzed in that part of your colon. So I still use a suppository, and if you use a suppository, all you're doing is, it's just like a doctor hitting your knee with one of those reflex things. You're just activating the reflex that's paralyzed that you would be able to activate like not manually, like with your brain. I don't know. I'm trying to think of what that's called. I don't know. My brain is not working right now, but that you would normally be able to activate on your own. Like if you want to have a bowel movement, you can push, relax your rectum, that kind of thing. You can't do that anymore when you're paralyzed. So when you use a suppository, you're activating that reflex. So when we try to control our bowels after we're paralyzed, the doctors, especially like when you're in rehab, they teach you, or maybe they don't teach you, they just tell you what to do. They don't actually teach you anything. They just tell you what to do and don't make you understand. But what they do is they try and use all the different reflexes in your intestines so that they coincide with each other. So when you eat, the reflexes from the top that you're stimulating when your stomach stretches, those create reflexes lower down so that your food moves through your digestive system. And then when you put the suppository in, you're activating that reflex lower down so that all of those work together to have a bowel movement. And so those are the things that we're trying to influence. And so when you want to have a bowel movement, you do digital stimulation, or you put a suppository in, whatever it is, to stimulate the bottom part that's paralyzed from the pelvic nerve, stimulate what the pelvic nerve can no longer stimulate. So that's what you don't have control over. And what you do have control over still is a lot of things. So how you eat, what you eat, when you eat, all of those things are still within your control. And all we're trying to do is stimulate the different reflexes so that we can have a bowel movement. So that was the first thing that I did to take control of my bowel, is I learned all of that so that I knew what I could still have control over. And I still use the suppository because I know what the suppository is trying to do. And when it goes in my butt, it irritates the lining of my rectum, and that stimulates the reflex of the pelvic, stimulates the pelvic reflex. And then all of this stuff in my lower colon, like the one that's going down my left side, it then starts to move down. So I still use that. I don't think it's a bad thing. And anything up the bottom part isn't habit forming. Anything through the top part is habit forming. So if you take laxatives through like your mouth, those are habit forming and can cause long-term dependency. But if you use anything up the butt, like a suppository or digital stimulation, that's not habit forming, because you can't really wear out a reflex. Just like a doctor can hit you as many times as he wants with his little thing and your leg would still kick, right? So that's the first thing that's important to understand. So the second thing that I did to take control of my bowels, I stopped doing what's convenient and started doing what was healthy and better for my body. So I used to try and do bowel routine as little as possible because I hated it. So I went as least as I could. I just wanted to get it out of my life. I hated it, and I wanted to only do it once a week if I could. And I have heard of people trying to do their bowel routine once a week. And so that's what I did. And the more I tried to limit my bowel routine, the worse my bowels got, because your bowel is like any other thing. And the less you use it, the more kinked up it gets. Like it needs constant moving. The stool needs to move through it. And the more time your stool is in your bowel, the drier it gets, because your colon's job is to absorb water. So if you leave it in there, it's absorbing water 24 hours a day, 7 days a week, and getting harder and harder. So the less you do your bowel routine, the harder the stool is going to be in your colon. And so I changed from doing my bowel routine as little as possible to doing it every day. I just decided that's what's healthy for my body, so I'm going to do it every day. That doesn't make sense for some people if they have like a care attendant or something like that they can only get certain times a week. So definitely you have to think about what you can manage with the help you have or the abilities you have. But my advice is go as often as you can with the resources that you have and the abilities that you have, because your bowels need to move often. And your bowels, it's not just about, the peristalsis and making sure that's always really good and not having dry stool. Your bowel is a detox organ. All of the things that your body collects as garbage, basically old hormones, anything your body detoxifies, comes out in your bowel, it comes out in your urine, it comes out in your sweat. And if you're stopping any of those things, then you're creating toxic buildup in your body. And especially for people with spinal cord injuries that can't sweat, we've already eliminated one of those detoxifying channels. And so then if we stop pooping regularly, then we're just kind of stopping up one of those too. So don't do what's convenient. Don't do what you want to do because you hate bowel routine. Find a way to just make it neutral. I used to hate it so much. I used to think, I hate bowel routine is the bane of my existence. And then I just flipped my mindset to going, it's neutral. It's not something I love to do. It's not something I'm jumping from, you know, the rooftops singing about, but it's neutral to me. So I just do it every day without fail. So that was the second thing I did to take control of my bowel. The third thing I did was eat nutrient dense food. So your bowel has a really hard time working if you are eating McDonald's and, you know, meal replacements like Slim Fast or whatever. Oh, geez. Is that me? No? Okay, it's better now. Okay, so you have to eat nutrient dense food. So like I said, we don't have a time to talk about every single thing, but the two things that I'm going to talk about in here are basically fiber and nutrients for your bowel. So fiber is super important nutrient, even though it doesn't have any calories in it. Fiber is important because the bacteria in your gut eat the fiber, and the bacteria in your gut are the things that are helping your body digest your food and move it along. And, you know, just it's creating lots of good things. The biggest portion of your stool bulk is usually dead bacteria. So if you have like hard, tiny little turds, you probably have a wasteland of bacteria and you don't have really healthy gut flora. So fiber, there's two kinds, insoluble fiber and soluble fiber. The insoluble fiber, think things that don't dissolve in water. So if you stick a piece of broccoli in water, it doesn't dissolve and it doesn't absorb any of the water. So green foods like spinach, broccoli, asparagus, all of that stuff, that's insoluble fiber. And it creates softer bowel movements. So if you're having problems with constipation, you need to add more green things that don't dissolve in water. And then there's soluble fiber, which does dissolve in water and it absorbs water. So think like chia seeds or oatmeal. If you stick that stuff in water, it soaks it up. So that stuff creates harder stools. Both are important, and knowing which one creates softer or harder stools allows you to decide what you need to eat more of if you're having problems with either one. So if you're having diarrhea, you need to eat more oatmeal, legumes, beans, chia seeds, things like that. If you're having problems with constipation, you need to eat more green food. You need to eat more insoluble fiber like lettuce and broccoli, those kinds of things. And you really need to think about the nutrient density of your food, because the cells in your digestive tract are cells. They need nutrients just like anything else. And if you're not giving them foods with vitamins and minerals and, you know, good fats and proteins and all of that stuff, then your cells aren't going to be healthy and they can't help you have a healthy bowel movement. So those were the things that I just wanted to mention. There's lots more that you can think about in terms of like healthy bowel, fermented foods and all that kind of stuff. But I think those are the most important, because your bacteria need to eat fiber. They eat fiber and make something called butyrate, which is the number one nutrients for the cells in your digestive tract. So eat fiber, and then also kind of figure out the magic number of fiber for you, because everybody has a different number. For me, that number of 25, 28 grams of fiber can sometimes be too much and I'll get constipated. So for me, that might be a little bit too much, and it depends on the type of fiber that I'm eating. So don't just take the number that you hear as gospel. I did watch a very informative presentation by a doctor educator, like he was educating other doctors, and he said the number for people with like paraplegia is more around the 15 gram a day fiber mark, just because then it's less likely to constipate you because you're not sort of bulking up your stool too much. But definitely play around with it. I have a friend who eats like 50 grams of fiber a day and does awesome on it. So you have to experiment is what I'm trying to say. Okay. And then the last thing that I did was I figured out natural ways to stimulate my bowel from the top. So the bottom, remember how I said suppositories and stuff aren't habit forming? So you can use that every day for the rest of your life if you have a spinal cord injury and it's not habit forming, and you'll be okay. But you have to find, if you're constipated, ways to stimulate your bowel from the top end, from the things that you're eating or supplements that you're taking that are more natural and that you're not using every single day. So if I get constipated, I try my very best to use food source laxatives like prunes. Almost any type of fruit has some sort of laxative component in it, which is why babies are, if they get constipated, they say eat fruit. Berries, prunes are just happen to be the best one. But any kind of fruit is good to eat. So try and figure out your constipation that way. If you can't, a natural laxative is senna, which everybody like knows what Senecot is. So that is a natural laxative, but I try and find it in like a food source, like in a tea or something like that. So it comes from the natural sources. It's not extracted from those natural sources. It's just in those teas, and you can find natural laxative teas. I'll throw the one that I like the most. It's called Swiss Chris, and I just get it on Amazon, and it's just all the tea leaves combined in a way that makes the right amount of senna. And so that's my go-to. And then there's other things called prokinetic agents, and those things help your intestines. So in between when you eat, when you're not eating, there's like waves kind of that clear out. Think of it like shaking your intestines, like you would shake a rug or something to clear up all the yucky stuff in the crevices of the rug and all that stuff. So your intestines do that. It's called the migrating motor complex. It's like the technical name for it. But there are certain things called prokinetic agents that help your intestines do that, and they speed up your bowel motility. So two of the ones that I use are magnesium, which is a mineral that you need in your body, and it's a supplement that's easy to take. I take it every day. It's good for muscle health. It's good for all kinds of stuff. So I take magnesium bisglycinate. I'll put that in the chat as well. And that one, and then I take magnesium oxide. My spelling is like massive thumbs. Magnesium oxide. So I take those two, and I take just one pill of each every night, and then it helps with my bowel. It helps with my sleep because it relaxes. It kind of relaxes you, calms you. And then ginger is another really good prokinetic agent, and all you have to do is make a really strong ginger tea. So I just buy like ginger root, and I grate about 2 inches of it into about 8 cups of water, and I let it boil for 10-15 minutes, sometimes 20 minutes, depending on how spicy you like it, because ginger tea can get really spicy. And then I drink that, and that's another really good way to stimulate your bowel. So yeah, those are all the things that I do. You guys can go check out that bladder care guide, because it's got, like I said, it's got lots of information in it, and a lot more natural bladder medicine. And then I will send to Jessie, I'll send another link for a little cheat sheet I have that has all the information about fiber and prokinetic agents and stuff like that. I just didn't grab it before this. I just didn't have time to grab it before this presentation to throw it in the chat. So yeah, you guys can ask me anything now. I'm all done.
So any and all questions, all you have to do is just unmute yourself and she will answer that. Also, just want to do another roundup of, if you're a manual wheelchair user, please drop your name into the chat to win a set of tires, because we could all use a new set of tires, right? So any questions that you guys have, please go ahead and ask them now. And yeah, thank you.
My name's Chelsea. Can you hear me?
Yeah, I can hear you.
So you mentioned that you didn't have a routine, really, a bowel routine, and you really just sat down with yourself, literally, and said, I'm going to do this thing and I'm just going to make it a part of every day. So I would say for myself, I've never really had a routine, and I've been injured. It's going to be 24 years in January. And so I'm curious what that was like for you to kind of, I mean, did you literally every day just pick a time and that just became your ritual?
Yep, I do it every day before, like it's my first thing I do in the morning. So I normally on the weekdays I get up at 5, just because my kids have to go to school and I want to get ready before they're up. So I want to be ready before 7. So I get up at 5 and I do bowel routine then. And then it's not always at 5. So on the weekends I might sleep until 6, and sometimes I might sleep until 8. So my body doesn't, it's not like it has to be 8 o'clock every day. It just is the first thing I do. I know that there are many people out there, and like for good reason, that tell you should eat before you do your bowel routine. That's just not something that I've ever gotten in the routine of doing, because I don't like getting out of bed before I put my suppository in. But it is a benefit to eat first, because it does stimulate the reflexes higher up that then stimulate some of the reflexes lower down. So it is beneficial if you want to get out of bed and eat breakfast first. And my answer to this one is always, if it works for you without eating, then it's okay. If it's not working before, and you're struggling, then try eating first. But yeah, it's something that I always do. So I wake up, I do stretches. So that's another thing that it's non-negotiable. I wake up, I sit up, I do stretches for my legs, which take me about less than 5 minutes. I lay down, I roll over, put my suppository in, and then I read a book, because I just lay on the bed for 10 minutes and I read my book while the suppository works kind of. And then when I feel my stomach kind of ready to do something, then I hop up on a blue pad on my chair and head to the toilet. And I'm usually on the toilet for like half an hour, sometimes as much as 40 minutes if, things are softer or more annoying. But yeah, it's just a part of my everyday, no matter where I am. If I'm at somebody's house, if I'm at a hotel, if I'm in a campground, it's non-negotiable.
All right. Thank you.
You're welcome.
It looks like William has a question. Go ahead and unmute yourself, William.
I have a question.
Jackie, will you unmute him? And then Stacy will get your question.
William, do you have a question? You have to unmute yourself.
Yeah, I think.
Yeah, we have to get you unmuted, Willie.
There you go.
Is that Willie?
There we go.
Oh,
Willie. Yeah,
Thank you
that's
very
you.
Sorry.
just basically wanted to ask her how long it took her once she started the consistency with her program. I've been injured 42 years, and there's been times I've had a fairly consistent program, and then something might happen, and then I would get off a track. But once you started your program consistently, how long did it take you, and how long did it last before it stopped again?
Do you mean like how long does my routine take me?
No, once you decided to do a routine, how long did it take you? A couple of months, 6 months? How long did it take you to what you described as a daily routine now?
It probably took me like I'm gonna say a solid 6 months to get to where I wasn't like, I'm gonna skip a day. You know what I mean? That kind of thing, to where I don't even think about it. Like I would never even think about skipping a day of bowel routine now. Like it just would never happen. Like I think I skipped a day in 2019 is the last day when I had to take a flight, and I felt awful. So I used to only do bowel routine Monday, Wednesday, Friday, and I do not know how I lived the weekend without pooping. Because if I poop, like I didn't go that well today, and I'm like, my stomach is not doing well. I'm like, it feels bloated and yucky. So it took me a good 6 months before it was ingrained in like my everyday.
Right. Yeah, because that's basically what I deal with Monday, Wednesday, and Friday. But I do have a lot of bloating in between, and it might be a little difficult to do it every day. But it seems like it might be more helpful to have a bowel movement more than that.
I think so. Like for me, just the science behind what your bowel does in between is it absorbs water. So I want to get my stool moving before it gets absorbing more water, because that just makes the stool harder to move through. And so that makes sense to me, and it seems to work better, and my bowel routine seems to go faster. The other thing that a lot of people say is, but my hemorrhoids will bleed and all that stuff. My hemorrhoids got significantly better when I started doing bowel routine every day, because my stool was softer and I had to spend less time on the toilet. So I wasn't trying to get out, massive amounts of poop. I had a little bit of poop and I was done. So most of the time I can just sit and I'll just go on my own before I have to start doing ditch stim and stuff. Whereas before, no way, because I had massive turds that were hard. So like that might be TMI, but that's seriously what it was like for me. So now it's a lot softer and it's way easier. So
thank you.
Yeah.
Can you hear me?
I can hear you. Yep.
First, I want to thank you so much, because this is the first conversation I have had, not only with a person that is paralyzed, but a female. And I live in a nursing home, and I was raised on a farm where we ate fresh food, raw vegetables. My mother gave us vitamins. I had healthy bowel movements every day. We drank water and cranberry juice. And I actually had to implement this in the nursing home. First, I got them to give us salads, but I said iceberg is just crunchy water. We need
It's
the
so
dark
bad.
lettuce. So I'm getting better nutrition in here, but I am labeled as a quadriplegic, and God has graced me with more movement. I move my arms now, and I can actually pick up a hair and remove it off of my body. And
Oh, that's
every
awesome.
week I do something new. But I am a firm believer in healthy eating, and also vitamins. But you gave me so much more information here. But my question is, I have two.
Mhm.
I have to stay in bed when I have a bowel movement. So they say lay on your left side.
Yep.
Did you hear that? Is that true?
Yep. That's because where you're paralyzed, so the mid-transverse colon, the one that goes across your belly, when you lay
Yeah.
on your left side, gravity is working to get the stool to go down the paralyzed part. So laying on the other side, you're fighting the gravity, and your body can move some of it with peristalsis, but the part that's paralyzed, it kind of gets stuck there. So I almost always lay on my left side to sleep too. Just not every single night, but I do a lot of the time, so that the gravity is kind of working. I'm working with gravity to move it in down towards the colon.
Yes. And I believe in having a bowel movement every day. And when I don't, like last night, I don't feel well. I feel so horrible today. But how do I'm 58 and I'm still learning about tablets and stuff. How do I get your notes? I don't know how to do that. I've been keep
Oh,
taking
in the
notes.
chat,
Yeah, I don't know how to do that.
you go down to the bottom of your screen, and
We'll
Uh-huh.
then
send it, and we'll send it in the post email as well. So Stacy, you'll
oh,
be able to rewatch this whole episode. You'll get a link to this, and then we're gonna send the link that she put in there to all of her notes as well directly to your email address. So then you don't even have to search for it. It will come right to your inbox.
Thank you. And I'm also going to share this with my new urologist and my GI doctor. but I'm having a really hard problem with the calculus sediment. Like I have a lot of sediment in my urine
Oh
and
yeah.
clogging my catheters.
Mhm.
I have to keep a catheter in 24 hours a day.
Yeah.
And I've been changing them like every other day, which is not good. I have a new urologist. I was in Kessler for 5.5 months after my injury, and I learned so much there. But when you go to doctors and I'm in a nursing home, I have to teach everyone. I have to teach doctors, I have to teach nurses how to take care of me.
Yeah.
And they used to give me a hard time, but now I've got it pretty good. But now I have a new urologist, and I just talked to him Friday and asked him, what I asked him if he ever heard of Renacidin. It's like a flush you flush
Mhm.
your bladder with.
Yep.
And is that good?
I've never heard of that, so I'm not sure about that. I do know that there's not going to be a doctor probably on this earth that's trained traditionally, like in pharmaceutical medicine, that's going to ever want you to do any of the things that I'm talking about.
Yeah.
All of my doctors, they don't even believe that I cured my bladder infections. They just say it was just like people who cure cancer. They say it was just luck or it was just spontaneous. So I know that I've had to fight an uphill battle with doctors in order to do stuff. And most of the time I don't even go to the doctor anymore just because I don't want to take antibiotics. And every time I go, they pressure me to take antibiotics and stuff like that. So you may find a very good doctor. Like I said, I ran into the one doctor who told me it was totally safe to not take antibiotics. And he was 100% supportive of my choice to try that. And he said, I will follow you and help you and do whatever so that you feel safe. I'll give you, antibiotics just in case, so you feel safe in your house if you get sick all of a sudden. Like he worked with me that way. So I'm not going to say never that you're going to find a good doctor, but you're probably going to be talking to a brick wall when you talk to a urologist about anything like that. That does sound like a more of a traditional pharmaceutical type thing, the flushing thing. And I have heard of a couple of people that use like an antibiotic and it only flushes their bladder or something. So it only goes in their bladder and not within their bloodstream. So I'm not sure, but yeah, I don't have any experience with indwelling catheters or flushing of any kind. So can't help you there. Sorry.
Well, I definitely don't believe in taking antibiotics all the time,
Mhm.
but I need to solve a problem of my sediment.
Yeah.
And I think
That's
if I follow what you're doing, I think my sediment would go away. Really, if I started eating more garlic, and I could definitely increase. I drink like 232 ounces of water a day, and I
oh, that's a
either
lot.
sometimes add cranberry or lemon juice.
Mhm.
Usually lemon in the morning because it cleans your stomach. Um, but I can't wait to read over all your notes. I took notes, but I'm going to really, really buckle down and do what you are doing. And I'm so proud of you. And you're such an inspiration. And I almost cried when you started talking about all the things that I have so many questions about and nobody knows. And I bet you my sediment will go away once I start this regimen. So
Well,
thank you.
I hope it helps. Like I said, I'm not an expert in the whole sediment thing. But I hope it helps. And if it does, yeah, then share it with other people. Share your knowledge with other people.
Thank you, honey.
And thank you, Stacy, for joining us and everyone for taking an hour out of your Monday night to join us for this. We have an entire week lined up of different courses just to help you become the best version of you and be able to live life to the absolute fullest. I do want to take a quick stop to say congratulations, Nicole. You are the winner of a brand new set of Kenda tires. And every single day. Oh, I'm sorry. Oh, you're unmuted. Welcome, Nicole. Thank you for joining us, even though you're sick too and you're not feeling 100%. We really appreciate that.
Thank you.
So every day this week, you guys, everyone, as long as you show up, you have the opportunity to win a set of tires. You have the opportunity to gain valuable information from other wheelchair users or other people with disabilities that understand what you're going through, that understand the struggles that you face. You are not alone in this life, and that's what we're here to help you and support you. Brittney, thank you so much for sharing your knowledge, your expertise. Like, I know you definitely blew me away for sure. I was just like, wow, there's so much I didn't know in there, and you just unpacked a lot. So thank you for taking an hour of your Monday, and thank you guys for spending an hour with us. We'll see you again tomorrow night. Look out for the email with the link to this recording, Brittney's information, and links to sign up for the rest of the week. We'll see you guys soon.
Okay, bye guys.